Okay, we are now live.
All right, thank you, Chrissy. This is the Senate Appropriations Committee, and we are continuing our work on the budget adjustment for this fiscal year. And testimony today is going to be from the Department of Mental Health regarding their proposed changes in the FY21 budget. So we have Commissioner Squirrel, Deputy Commissioner Fox, and we have Shannon Thompson, who's their Chief Fiscal Officer. I guess that's your title, right, Shannon? Or are you whatever you are? Glad to have you here. So do you want to get started? The House has passed out the budget adjustment. So if you know what they have done relative to your, we haven't had a chance to go through it, but if you could just link it, if possible, if you propose something and it's in or it's out, that'll be helpful. So shall we start with you, Commissioner?
Sure, yeah, happy to. Would it be helpful for me to share my screen so folks can see the talking points, or should I just walk through them?
No, it's fine to share the screen.
Okay.
Although we do like looking at people's faces, but.
Looks like I can't.
I just made you a co-host, Sarah. I might want to try one more time.
Okay.
Great.
Okay, how's that? Can you all see my screen?
Yes.
Yeah.
Oh, wonderful. Great.
Good.
Okay, well, I know we want to be efficient with our time, so I will move through this as quickly as I can. As far as I know, all of the BAA items that DMH put forward were approved by the House. So we have 4 FY21 BAA items. I'll start right at the top. The first one is related to our proposal to continue a 12-hour shift model of the Vermont Psychiatric Care Hospital. So just some background, when COVID-19 hit the state of Vermont, one of the most significant impacts to the hospital, the Vermont Psychiatric Care Hospital, was staffing shortages. And folks may recall that those staffing shortages were so significant, we actually had to move residents from the Middlesex Therapeutic Community Residence to VPCH to consolidate staffing. At that time, and the peak of the pandemic, we also temporarily transitioned to a 12-hour shift model. This would allow us to really better navigate infection control, to consolidate our staffing, and to be more effective with those resources. Certainly this temporary pilot has been a real opportunity for us to test the effectiveness of 12-hour shifts at the hospital and has been very, very successful. The previous 8-hour shift model was definitely contributing to some challenges for us in terms of employee dissatisfaction, operational shortcomings. It's a recruitment barrier. 12-hour shifts are really an industry standard. So we're trying to recruit nurses, as we know, is a priority for the state of Vermont, or mental health specialists. With the math of an 8-hour shift model, essentially when you're first hired, you essentially have to work every single weekend. Not a great recruitment strategy, especially when you're working in a setting like the Vermont Psychiatric Care Hospital. We also have high levels of absenteeism and turnover, and a lot of reliance on overtime. So the 12-hour shift model that we pivoted to, we were able to bargain that with VSCA temporarily. And the way that we were able to bargain it temporarily was the first 8 hours are regular pay, and then the 4 hours on top of that to get to the 12 are overtime. So clearly that's not sustainable. We've been able to use CRF funds for those additional 4 hours of overtime, and we really think it's in the best interest of the hospital, patients, and staff to move forward with a full-time 12-hour shift model. As I mentioned, some of the benefits of that model include—
Commissioner, I just need to be clear. So if you want to move forward with the 12-hour and make it your regular, are you still having to do the 8 hours at regular pay, 4 hours at overtime, or are you establishing a standard rate for all 12 hours?
Yeah, we'd be looking to bargain and establish a standard rate for all 12 hours. So that's exactly what we would need to do next.
All right, okay.
Yeah, and just to highlight a couple of the areas where we've seen significant gains and improvement, it's absolutely improved our retention and stability of our staffing. We've seen reduced absenteeism, reduced errors, And because of less shift changes with a 12-hour model, we've actually seen an improvement in patient care and safety and a reduction in the provision of emergency and voluntary procedures such as seclusion and restraint. I think it will, going forward, allow us to more effectively operate the hospital and certainly move us towards a more sustainable and healthy workforce, particularly with our nurses. So in terms of next steps, we will, in collaboration with Labor Relations, need to bargain the terms of this proposal. Due to the timing of the budget cycle, we had to ensure that we got something into our FY21 BAA so the appropriate committees could understand where we were headed from a policy perspective and to make the request for the legislature for the funding. So you can
let me ask, at the agency level, since this is not the only facility 24/7, and if you're saying it's the industry standard, are you talking about just within healthcare, or are you talking about in other areas? And one of the areas I'm thinking of, Senator Sears, it's obvious one, and that's what our correctional facility shifts look like.
Yes, this is specific.
Yeah, that's, and they tried this at Woodside, and I think it was part of the failure there, frankly.
Oh, well, but that follows a litany of problems, doesn't it?
Yeah, I'm not sure that, it may be the industry standard. But
Yes.
I get pretty burned out after 8 hours on Zoom. I don't know if I can handle 12.
Oh, well, and it may be within that healthcare delivery context that this model works better. I was just raising it, whether there was a transferability, but we'll keep going with your request here. In terms of your experience to date, has it also had a beneficial impact? You had to hire some traveling contracted nurses. Are you still having to do that?
So currently, yes, just because of the global, staffing pressures that we're under due to COVID, and of course, just the general nursing shortage that we're seeing right now. Part of this model, though, and why the increase monetarily is so modest is because this will reduce our overall reliance on travel nurses. We would absolutely be able to recruit either travel nurses who might move into more full-time work with us, or just recruit more nursing in general, which reduces our reduction on travel nurses, which we all know that contracted labor is very, very expensive. And so that's part of kind of the fiscal modeling on the back end of this, in terms of the savings that we achieve by reduced reliance on travel nurses. I would just add that we have an obligation to the collective bargaining process that needs to continue. We don't want to interfere with that process, but we wanted to make sure that this was articulated in our FY21 BAA.
Okay. Senator Baruth has a question.
Thank you, Commissioner. I appreciate that there will be attention to the collective bargaining process. Can you give us a heads up? Are the employees, do they seem to be in favor of this move and they're just looking to cast the details correctly? Or because it seems like the loss of overtime would be significant.
Yes, so my understanding, and this has been strategic work that has been done with VSC, not with VSCA, but in collaboration with VSCA over the past couple of years. There's been a lot of strategic planning around this. There was a survey conducted by VSCA just to get kind of member opinions. And at that time, 86% of the employees at VPCH were in favor of this proposed transition. How that actually effectively works in terms of, moving to this new model from a fiscal standpoint, we'll have to see. But certainly that was some of the data that we were using to inform moving in this direction.
Okay, thank you.
Of course.
Okay,
So
we'll keep
it. Serves the chair, I'll move on.
Yeah, I have to. My cat just came downstairs and opened the door, which is cold. So I've got to close the door, but please continue.
Okay. So the next item is more of a technical accounting item. This is the backfill of unallowable CRF indirect expenses that are being transferred from the Department of
yeah.
Corrections. AHS net neutral. I don't know if the committee requires me to go into a lot of detail
No,
on.
no, what it's doing is we were using CRF for indirect costs, which were not permissible. So we're just swapping them out for direct permissible costs, and corrections is a permissible expenditure area. So we understand it basically is a swap for indirect to direct throughout the agency.
Just FYI, that whole issue became a issue in the House Corrections and Institutions when they looked at the correction budget.
Yeah, I don't know if they
Budget
really
adjustment
understood what was happening here.
Well, I understand that. I just wanted to mention that it had become quite the issue, and that evidently one member of the committee voted against the proposal to use the money that way. So I guess it amounted to a total of about 5 million, as I remember.
It was probably a bit more than that throughout the entire agency, but either way, you were paying it for staff, whether it's direct or indirect. But
Right.
because it involved corrections, which was the easiest place to go for permissible CRF use, I can see why it raised the questions if people didn't understand kind of all the mechanics underneath it. Well, thank you for sharing that, Senator Sears.
Well, actually, I think if Stephanie were to write a little blurb about that, it would help us if it comes up on the floor.
It would help us what?
If it comes up on the floor when we
Oh,
present the Budget Adjustment Act.
yeah, well, I have to report it.
I know.
I think I got it, though.
Well, if I could have what you just said written down, that would be helpful.
Okay. Oh, but budget adjustment, usually the chair reports it.
I'm not asking to report it. I'm asking to have a.
All right, we'll give you an explanation on it. I thought you were afraid that when you presented it, you were going to have to answer the
I
question.
wasn't planning on presenting anything. I'm going to sit in my Zoom chair wherever I am. Hopefully, and listen to you, but I wanted the explanation if it came up.
Oh, okay. All right. All right. I was going to say, well, I just wanted to be clear that we were, the BAA, we weren't divvying up the way we normally do the budget, but
Fine.
obviously you understand that.
I knew that, but, and we're very, I can only speak as one member of the committee, but I think the committee is unanimous that we were very happy to have you report the whole thing.
Absolutely.
Yep.
Definitely.
Well, let's hope I don't get sick.
That's right.
Then it devolves to the vice chair.
Uh-huh.
Senator Nick, then it devolves to the clerk.
Oh, yeah. Well, what about our ranking member?
Well,
Yeah.
I think that's fourth.
Yeah.
Oh.
And the alternate ranking member.
I don't know.
would
Does
suggest-
the clerk come first or the ranking? I guess the ranking member is be third.
You know, I think that gets us down to Senator
I'll have to
Bruce.
check with the House.
About the new member. Oh, we don't.
I
Well, all
would
right,
just move to postpone action.
Good move.
All right, I understand what it is. It's the question or why it came up within that committee. And committees that don't work with money and swaps, the kind of the way we do, I understand it can raise questions and obviously did. Okay, so we'll keep going to the Wyndham Center now that we've gotten that one, unless there are further discussions, but this is something we're going to see in all the budgets related to the indirects. I guess the institutions committee didn't want Mike Smith and Sarah Clark and all the folks that have made all this CRF money work and would be there as indirect costs. They don't care about that, huh, Dick?
Oh, I think I'll remain neutral here.
Oh,
I-
okay.
I just would like an explanation so I can.
Yep. Okay, we can provide that. And Stephanie's on the line. Wyndham Center.
Okay, I will continue. Thank you. So as everyone is aware, we moved quickly to be responsive to COVID to ensure that we had inpatient capacity for Vermonters who might be requiring inpatient level of care and who were also COVID positive. This was the recommendation on behalf of all of our inpatient hospitals across the state. We worked with the Wyndham Center, which is a part of the Springfield Hospital, to stand up a 10-bed COVID positive unit. I think that this effort really demonstrates really decisive, proactive action that we took as a state to ensure that Vermonters who are experiencing a mental health crisis had access to timely care, even if they were COVID positive. And what this capacity has already accomplished is it allowed us to allow those individuals who were COVID positive to have timely access to care, and also very importantly allowed us to mitigate the spread of COVID-19 in our psychiatric inpatient facilities. We are all aware of how fragile our inpatient system of care is. We're experiencing decreased capacity. So by having this inpatient capacity at the Wyndham Center, we essentially protected all of our other inpatient capacity across the state. As Vermont continues to manage the pandemic and we saw a continued increase in cases at the community level, we did make the decision to move forward with extending, with your support, the Wyndham Center through March of this year. The funding source for this is FEMA funding. FEMA will cover 75% of the costs, and the remaining 25% is paid with CRF. We will certainly continue to monitor the system of care and COVID's impact on the state of Vermont. We'll continue to monitor the need for a facility like this, and the Wyndham Center can very easily convert back to a traditional 10-bed adult unit. We really just want to ensure that we have this capacity while we are experiencing an increase in cases currently.
Have you had to use that 10-bed facility?
Yes, we have regularly. And right now, actually, as we are experiencing outbreaks in some of our residential facilities across the state, individuals presenting in EDs, having this capacity has really been essential to move those individuals quickly to the appropriate level of care to support the entire system. So yes, it has been used regularly over the past several months.
So could you just, is the plan to keep these 10 beds online as part of your system of care?
Yes, that's correct.
Okay. And it seemed to me that these were very cost-effective beds in terms of how they compared with other inpatient placements.
Yeah, I think that's a really fair assessment, given that it was already an existing inpatient unit. The upgrades to the facility, while important, were fairly minimal. Really what we needed to do was ensure that the facility could accept level 1 patients. The Wyndham Center was previously accepting voluntary patients. We needed to bring the facility up to a higher level of safety. We were able to implement those upgrades at a very reasonable upfront cost versus, for example, completely building brand new level 1 beds from scratch, which is essentially what we've done with the 12 new level 1 beds at the Brattleboro Retreat. So yes, I would say this was a very cost-effective way to increase capacity at the Wyndham Center.
Mm-hmm. Okay, well, obviously the last financial report from the Brattleboro Retreat was very stark in terms of their financial situation. So we hope that can get stabilized as well. Questions about the Wyndham Center? Alice, that's Springfield?
No questions.
No, okay. But at some point then continuation would then be part of your base budget that you're going to be presenting in 22 for 22?
Yeah, essentially the Wyndham Center, if it did revert back to a traditional unit, DEVA and DMH provide the Medicaid for those services. It wouldn't necessarily be a new level 1 contract, if you will. It would just convert back to a traditional unit.
Okay. And earlier in your comments, you mentioned the Middlesex facility and then I guess, gosh, Senator Sears, my memory's right. That was then emptied, and then we moved the kids at Woodside there temporarily, and then they moved back.
They went to
What's
St. Albans, they went to down to the Middlesex facility, then back to Woodside, I guess.
so is the Middlesex facility empty? Is now?
No, the residents were moved back to the Middlesex facility a few months ago.
So are there 7 residents there?
There are 6 or 7 right now. Deputy Commissioner Morning Fox might have the actual number.
Currently, there are 6. There's 1 bed that we use for quarantining of new admissions. And so we're just looking at filling that last bed with the next admission at this point, just freeing that up.
Okay. So that's still functioning now as part of your system.
Correct.
Thank you.
Okay.
Unless there are further questions, we'll move to the last.
Okay, the last item on our FY21 BAA is again kind of a technical accounting piece, which is FY20 carry forward funds from the Agency of Human Services for Rutland Regional Medical Center's cost settlement. Just for the committee's awareness, per Vermont statute, the Department of Mental Health is required to pay hospitals who are providing level 1 care reasonable and actual costs for providing those services. That's part of the level 1 system that we put in place when we closed the Vermont State Hospital. These hospitals are essentially paid a daily rate for providing that care. And then we do a cost settlement or reconciliation at the end of the year. There's also an interim settlement to ensure that we're covering all of those costs. So we carried forward general fund from FY20 to support Rutland's FY20 interim cost settlement. And this is to transfer the global commitment allocation that was invoiced and paid in FY21. Shannon, is there anything you would add to that from a technical accounting perspective?
Nope, that's exactly right. We would have normally paid that in FY20, but because that didn't happen, it rolled into FY21. So we just had the general fund to carry forward to pay for that in 21.
Okay. Yeah, it's just a timing of when you got the cost settlement.
Exactly.
Yeah.
Yes.
Okay.
Can I
A question? Yes, Dick.
Yeah,
Sears?
I guess I would like to go back to the turnover rates of 16.8%, exceeded by only 6 other state departments. Actually, 16.8% during this COVID crisis is not high. I heard today from a private provider that they hired 50 people and 46 left. So I'm, during this COVID crisis, I think 16.8 is probably something that the Department of Corrections would relish. They're huge, high, very high. It would be, I would, I still have, you go ahead and do your 12-hour shifts, but I still think it's a recipe for problems. But I guess I'm just old-fashioned. But I would like to get a list from the administration of all departments and how you're number 6.
Yeah, absolutely, Senator Sears. We're happy to do some follow-up on this data. It looks like the turnover for mental health specialists was around 35%. Registered nurses was around 50%. So I'm also trying to make the connection between that 16.8% as I look at these talking points more clearly. So maybe we should go back and relook at that and make sure that this is accurately representing.
I think if you ask Jim Baker, if he could get his retention rate to 16.8%, that would be a success.
Yeah, and certainly,
Yeah.
I'm sure Senator Sears, you can appreciate the challenge of working in the Vermont Psychiatric Care Hospital with those
I can
individuals,
appreciate the challenge of working anywhere today under these conditions.
of course.
You know, I mean, I meant with people, when you're in direct line with people and I have absolutely no problem with the unemployment bonus that we're trying to do to help families who've been thrown out of work through no fault of their own, but it does make it inviting for those that are low level pay and are asked to do extraordinary things on the front lines, whether they be in a grocery store or at a residential home or whatever, when they see neighbors and friends making almost as much, if not more, by being at home.
Unless we're, I was going to say we could pull down the summary of the budget adjustment of the talking points so we can all see one another. Because I can't see Senator Sears, but I know who's talking because he has a very recognizable voice, as does just about everybody else on the committee. Welcome, Senator Westman. Other questions about Department of Mental Health? I have a question as it relates to, we've heard the governor's budget now that it's been unveiled for 2022. There is, in terms of the budget itself, everything seems to be level funded. So I gather state employees will continue to get the second year of their contract, but there's no proposed increase to deal with any comparable costs in your DAs and your SSAs. Is that obviously SSAs are more Dale, but are you doing anything other than just adding a little bit more money to provide more services?
Yeah, so I think some of the areas that we can talk about a little bit more in detail in our FY22 budget presentation is that one of the things that happened when COVID impacted the state was we had to really readjust and shift the provision of community mental health services. We're very fortunate at DMH that we had already implemented payment reform. So our DAs and SSAs were already being paid a prospective payment up front. And so we were essentially able to continue that payment up front, knowing that their utilization and volume of services on the back end may look very different. In addition to that, we also provided the DAs and SSAs with, I think the total was $19.3 million in CRF funding. In addition to that, we also have several other federal resources where we've been partnering with the DAs and SSAs to bolster crisis services, peer services, et cetera. So yes, in terms of the FY22 budget, it is presented as level funded for those community providers. And I do think, as we move out of, the COVID time, really stepping back and assessing need and where other opportunities might need more targeted resources. And ideally, we can look to some of the increased federal funds that we'll be receiving. ADAP and DMH were notified that we have a SAMHSA grant from that was related to emergency COVID. We are receiving an additional $2.8 million that can be utilized between now and FY22. Our FY22 budget presentation will provide more of a comprehensive overview of some of the additional federal funding that we'll be receiving.
Okay, but in terms of base general fund support, it's level funded.
That's correct.
Okay. Anything else for the folks here from DMH? Okay. If not, then we will let you get back to your other work at hand. We have Dale next, is that right? I can't see the
Yes,
agenda.
Yep, Dale is next and they are here.
They are, okay. All right then.
Senator Kitchell, just one thing I would add in terms of base investment, there is an allocation for an increase in funding that would go to our community mental health agencies to implement mobile response. So that is one I just wanted to note.
Okay.
Okay. Thank you very
Thank
much
you.
for your time this afternoon. Greatly appreciate it.
Thank you.
Yo.
All right, so we're going to move on to aging independent living folks from Dale. I can see Commissioner Hutt, Megan Tierney Ward, and do we have other, are you it?
Bill Kelly should be here as well, Chairwoman.
I was wondering if Bill was coming or,
Certainly better be.
He's here. I can see him in the participant room.
okay.
Yeah. I'm here.
All right. So we'll move on next to the budget adjustment requests from Dale, and we have the commissioner. I guess you'll lead us off and then or hand it over or however you want to do it. But if you want to start, Monica, that would be great.
Great. Thank you so much. For the record, Monica Hutt, I'm the Commissioner at the Department of Disabilities, Aging and Independent Living. And it's a little late, but Happy New Year to all of you. I think this is the first time I'm in front of you this session. I also was going to share my screen as Commissioner Squirrel did. I think that you have our testimony. But is that okay for me to go ahead and do that?
Yes, fine. It's just talking points. Is that what you have, Monica? It's your usual graph. I
It's
know.
our usual, right? Bill actually creates that. It kind of follows along with the.
Yeah. No, it's a very helpful document. So that if you want to share it, put it on the screen, that's fine.
I can never tell if you're actually seeing it. So is that up for you?
Well, we're kind of in the middle here.
Yes. Okay. Thank you. Let me get you to the beginning. So again, typically Bill Kelly creates this and it maps to the ups and downs document. It's just a little bit easier to read. I know we're starting a little bit later and I think you've got Diva coming in right behind me. So just as a very quick reminder, the first couple of pages just quickly walk through the 5 divisions in the department and give you just a quick snapshot of the work that they do. But if it makes sense to you, Senator Kitchell, I'm just going to jump to the numbers section.
Yeah, that's fine. And people can, for those of us have been on, but otherwise, I believe Senator Bruce, he's very good at reading material. So he can take a look at this later on.
And Senator, I'm always happy to sit with you and just talk through the department if that would be helpful. So just let me know.
Okay.
So as I said, this document maps to the ups and downs, and the very first section is really just a summary of what you will see appropriation by appropriation as I go through the document. The first point I would make is that there really are just 4 items in our budget adjustment, 3 of which are budget neutral or net neutral to the agency. So the only ask for additional dollars is for the collective bargaining agreement. And you'll see that broken out by programs. So this is the summary. The change is just a little over 2 million, as you see. And again, 3 of the items are actually net neutral. So just going through the first appropriation is the Dale administration appropriation. And it sounds like you had this conversation a little bit already with Commissioner Squirrel, but there were some unallowable CRF indirect costs that the agency needed to do some shifting. So what you see here is the 132,478. It's budget neutral. It was a shift in dollars with the Department of Corrections.
We understand it.
that
Thank
part
you.
of it. Yeah, that's pretty
Mhm.
straightforward. So then the next section is in the Dale grant section, and this is where you'll start to see the collective bargaining agreement as it breaks out across the different programs. So as a reminder, in the Dale grant section is our attendant services program, both the Medicaid attendant services program and the general fund attendant services program. And so for those independent support workers that are being hired by individuals or families to provide services in people's homes, the collective bargaining agreement, that portion of those dollars for those individuals is here in the Dale grant section, and that's that $25,150. The second item in this appropriation is the one-time funding that we need to transfer from the agency to Dale to support the SASH grant. As you will recall, there were 3 years of one-time funding that the legislature appropriated to the agency for SASH, and each year we just need the spending authority shifted from the agency to Dale. So that transfer is there for the SASH grant.
And what do we do at the end of year 3? I knew we were a step down, but
Yeah, so
can you just remind us? Because this is new to new, or we need a refresher for those that have been on.
Yes, absolutely. So this is year 2, was a 3-year step down program. And the intent is that OneCare will assume this portion of the SASH funding. SASH still has a grant with Dale and will continue to have a grant with Dale. So the total actual grant for SASH is about $970,000 a year. This is just a portion of it. The rest will maintain through Dale, but the intent is to have this conversation with OneCare. And we've been initiating those conversations with them for them to absorb this portion of the SASH grant, as they're already funding SASH themselves. So it's just the idea of consolidating some of the SASH funding in OneCare while Dale continues to support another portion of that grant.
Okay.
So the next 2 appropriations, there are no changes requested. The Division for the Blind and Visually Impaired and Vocational Rehabilitation. There are no requested budget adjustment in either of those appropriations. The next appropriations is Developmental Services. And again, you see a portion of the collective bargaining agreement. So this is obviously 6 months of the CBA changes in FY21. And that's in the developmental services system. So all those individuals that are independent support workers hired by families or individuals, this is that portion, 6 months of the collective bargaining agreement in that appropriation. No changes requested in the traumatic brain injury appropriation. And then finally, in Choices for Care, you see the final portion of the collective bargaining agreement there. For those individuals that are hired by families or individuals themselves. And then just a net neutral spending authority carry forward of the Choices for Care funds from state fiscal year 20 to 21 to ensure that we maintain that in the Choices for Care budget to continue to support high and highest. So it's pretty straightforward. And I don't know if there are questions or if you want me to close my screen or walk through anything more specifically.
Well, unless people want to look at the figures again, and they are available on our website, I think maybe we can go back to looking at each other, and I will see if there are further questions of you, Monica.
Okay.
Okay. Questions of the commissioner or her staff? Pretty straightforward. It's
There's no change in state policy, so it's pretty straightforward.
yeah, we don't tend to want to do that in budget adjustment. So it's reflective of the collective bargaining agreement, which you didn't know how that would materialize at the time you were developing the budget.
Correct.
Okay, and keeping any carry forward in Choices for Care, which is obviously something that people look at to make sure that it's not being used for other purposes. So I think it's fairly straightforward, but questions?
Nope.
No.
Good.
you're gonna get off easy, Monica.
It's never a bad thing.
No, I know.
Well,
Okay, well, we'll be hearing more from you, obviously, when you come back in on the 22 budget proposal.
Absolutely.
Okay.
Great. Thank you all so very much.
yeah,
Yep.
thank you.
Bye.
So do we have the Diva folks in the waiting room?
They're actually here. So
Oh,
they are, yep, Corey's here and Lisa.
All right. So now we're on to Diva. And Corey, you're gonna lead off, and then you've got some staff. Lisa's here with you. Any other staff today, or?
Not today, Senator Kitchell.
Oh, but don't worry, I'll fill in for you.
Where do you want to start? I think
No,
Sarah
I'm-
was in and already went through this with you guys. Senator Starr wanted to hear from Sarah Clark, not, I appreciate that too. She's pretty cool. I think you've seen our stuff already.
She's
Okay.
very smart.
She is. I totally agree. So is Lisa Schilling.
Well, that's the secret to success, surrounding yourself with very smart people.
Absolutely.
that-
Sure. Do you want to go by the ups downs? You've often wanted to prefer the ups downs, but we do have a document that is like a narrative that we could watch.
I think the narrative is easier to go through the ups and downs, where you go through sections that may not change or very modest changes. You've probably done a highlight sheet or summary sheet.
Right, yeah.
And
So
I think that
we'll share that now.
I think not that I want to say I love the ups and downs because I'm the mother of that ups and downs sheet.
I've learned over time the value of it. So
yeah. So, but I think if we could just go with the documents that you're shaking your head, Senator Sears. That was so long ago.
I know.
Okay.
Oh, golly, only 4?
So I'm sharing my screen. Can you see it?
Yes, we can.
Wonderful. Thank you, Chairwoman.
okay, so Lisa, slide up if you can a little bit. So the budget adjustment is really a lot of technical money moving. The gross administration and program add up to 5 million, but in the administration there is it's all net neutral to AHS, so it's moving like we can just jump into it, but there's the net neutral, the admin is net neutral, and the program, it's a state general fund increased ask of actually 52,000. So on over 800 million, it's a pretty small number, but I'm going to walk through unless you want to jump in.
Well, we did get a copy of a memo that was sent to House Appropriations saying that that while this was being recommended to go to the ACO, that again, there's been no system delivery reform appropriation going to the community-based organizations.
Right, I'm aware of the memo. This is not more DSR money for the ACO. This is money that was approved last year. This is just the transfer from AHS to AHS carried it forward. Now it's being transferred to from last year's budget to us because we were the mechanism by which the ACO was paid those dollars. So and the money's gone already. It's more of an accounting to get Eva's budget back to where it should be.
Okay, so you did see that the memo.
I did, yeah. I mean, I understand. I don't think that everything in that memo was exactly the way it is. I don't want to go too deep into it because we've got our other things, but I found that that memo to not exactly be a fair characterization of how things have gone.
Okay, well, I think what you're saying is the money was approved by the legislature last year and it was appropriated to the agency and it's simply being transferred to DEVA for the actual payout.
Yeah, and in fact, the payout's been made. We went And so this was for calendar year 2020. So for 2021, there aren't any, the current calendar year, which is what those ACO contracts are on, don't have a DSR payment or proposal in it. That, I mean, that could happen, but that's not what this is. So, yeah. Leave
All
it
right,
there.
thank you.
Second one is, I believe you've heard about this from the other departments. It's, you know, the changing information we have on the indirects, and it's that neutral as well to AHS. So that's our admin changes. Otherwise, we're on budget and on track. Let's move to program, Lisa. So there are 3 ups. There's 2 ups and 1 down in our budget that are the real sort of items. And again, I know Sarah discussed this with you. We do have caseload increases. We have an increase in enrollment. We think there's 2 reasons for that. One is, of course, the pandemic and changing income circumstance for individuals in the state of Vermont. The second, though, is that in order to get the FMAP bump of 6.2%, there is a continuous enrollment requirement for us. So we right now are not doing redeterminations and removing ineligible individuals from the program when appropriate. So we've halted that effort, and so our numbers are growing, not in a huge way. I believe this committee has been through this in the past about the caseloads, and and there's a couple other points too, that it's caseload and utilization. The utilization is actually not as high as you would expect for the number of people who've come on the program. So it is either that there are people in the program that aren't really using it, right, because we're not taking anyone off the program, or it is probably more likely and more weight would be given to the fact that people just are not getting care at the same rate for the sake of staying out of you know, those environments, the hospital environments or the, you know, medical environments. You know, both are probably part of it, but I would say that there is probably some deferred care going on.
Okay.
So you see too that the 8.1 there is, you know, the state share is only 2.5. That's because there's a lot in the 90-10 match group, the expansion group, new to Medicaid. And so that just is an explanation for the difference between the 8 and 2.5 versus what we would normally expect in the 4 million range, right? There's the sections at the bottom in the chart if you need it or want it, where they fit in the different appropriations. So the second one, number 4, let's go to that, Lisa. This one is a down in our budget, and this kind of offsets the previous, which is this is our ACO reconciliation from 2019. So when we completed that reconciliation, simple way to say it, we had an agreed upon price. The fee for service portion of that of the attributed spend on attributed lives, the ACO owed the state back for those dollars, and they've repaid us already, and we're sort of reconciling that against, well, it's just coming in, but it kind of reconciles against the increased caseload bump that we are seeing for this current fiscal year.
Okay, so what you cost on one side is being offset by this.
Yeah, otherwise we'd be asking for more money. This covering that. And it's part of the hope, right, that we smooth out the peaks and valleys in between payers and providers with this type of risk-based arrangement.
Okay.
Okay. So the next one is the other, where there's an up, and this is every year we come in with a Medicare buy-in price adjustment, and the calculation says that we need to contribute more money, and you see the total there. Not much more to say about it.
Oh, I love these Quimbies, Slimbies, and Cuties.
Yep.
The different groups. Okay.
The last 2 are very technical in nature. They're net neutral. well, this one's net neutral. So this relates to our 1115 waiver in waivers previous to 2617. We had the authority to put IMD expenditures as an investment in our, in our global commitment. But we lost that ability to use to pay for IMDs through investment in the 2016 negotiation. And we were put on a phase down pathway that needs to be completed. I believe the date is 2024. And so this is a phase down of the of IMD expenditures within the global commitment or as an investment. The reason it's a zero is that we did get the SMI and SUD waivers a little over a year ago that I'm sure you've heard about, and that allows us to continue to get federal match for for this portion of the expenditure. It's not all of it. We still have some IMD expenditures in our investment because it's phased down. We have a few more years to go, but I think this is, it'd be worthwhile to note with this committee that we are fast approaching going to CMS with a 1115 renewal proposal, and IMD is part of that. As we continue to build, we're not yet at a proposal phase, but we are in the building phase, and IMD getting back that authority to cover all of our IMD or as much as possible in the waiver is something we're focused on right now.
Are you optimistic?
Have to be optimistic for sure, but we'll see.
Okay.
Works. New administration, more optimistic with the new administration, I guess I would say, for one thing, just because it wasn't the last administration that took away our authority, but I think we have a pretty good story to tell. So since you're asking about optimism, we have a good story to tell in terms of access to mental health.
I just find it, and I know it's been tested legally, but it just seems like we talk about the importance of mental health care and treatment. We talk about parity, and to me, this is we would never say to someone who has a very serious physical condition that required going into an ICU, we don't cover it. I mean, it just seems like it's discriminatory as it relates to the treatment that Vermonters with high acuity, their mental health needs are at a very high level. That's not a covered Medicaid expenditure. It just seems like this is an old legacy limitation that needs to be revisited in light of our understanding of mental illness. But that's only my 2 cents for today.
I agree. So the last one is related to the clawback. And so usually we come in and tell you about an increase we need in clawback, but with the increase in FMAP, to calculate the clawback contribution, you use our FMAP. And so with the FMAP getting bigger, it frees up some state dollars. And our proposal is to carry these forward into 2022 to cover future expenditures and needs.
Okay, and the clawback is all state.
Yeah, right. But it's all state, but the calculation is based on FMAP. So
yeah, I know, I understand, because I raised that question with Sarah the other day in terms of being all general fund or state dollars.
Yeah, this is definitely a BAA type thing where this isn't the whole picture. And
no, you're using excess federal receipts. Looks like.
Was that a question?
No. In other words, you're saving general funds because of these higher federal receipts, and you're carrying forward the general funds.
So federal receipts, the 6.2 bump goes into affects this calculation, and that's how it's.
Yeah, you're using those higher federal receipts to pay what general fund because they're freed up and converted.
But there's actually not a receipt. It's just a calculation.
well, calculation, but
Okay.
yeah, okay.
Yeah, and we just don't, and we need less than we have in the budget. So it doesn't change our budget because we're talking about taking that money from this current fiscal year and moving it to the next.
Yeah,
So
okay. All right, so we'll see this again in FY22. All right.
Right,
Is
well,
that
that's,
it?
yeah, we're definitely gonna see it in what we understand is we're going to see a continuation of the FMAP bump. That's for sure.
Okay. All right. Is that number 7?
That's it. Yeah.
That's it?
You made it to the
Okay,
end.
then we can go back and look at the committee again. All right. So I can see if anyone has questions around the budget adjustment. Bobby, you're talking, but I can't hear you. Or you're talking to your cat.
No, I was talking to you.
Oh, all right. What
No, I
did,
just said, Corey had a pretty short list there.
oh, for a big program, it really is not too much. How are we doing with our 52 points of light?
It's gone up and down. If you've been paying attention to we were behind in pharmaceutical rebate receipts, but we had a run on those kind of near the beginning of the year, which helped us a lot. We also, with the reconciliation, this BAA reconciliation with the ACO, that helped us out quite a bit too. So as of this week, you'll get one tomorrow but we're up in the positive 10 million, but we continue to have these expansion of caseloads, incremental and steady, but not overwhelming. And we're carefully watching utilization. We think that utilization will bounce back on deferred care. So looks good right now. We're in the green, they call it, but I think we're probably projecting to hit our number and be by the end that will slowly shrink. So Lisa, did you want to add anything?
If I can get myself off mute. No, I think you've captured it, Corey. The 52 points does reflect our BAA proposal, though.
Philip, as a new committee, Medicaid is such a big program that for many years, starting back when Governor Snelling was in office, we actually track Medicaid payouts week to week. So that helps us monitor over time how we're spending relative to the appropriation. So it's unique to this one program simply to do that kind of weekly tracking, simply because it's such a large expenditure.
And you call it 52 points of light?
We called it 52 points of light, and that was something, it was named by Peter Preferer, who was head of administrative services at the agency at the time. And we've just kept it there. It was something that we developed, and we just, because it's weekly, unless we have a 53rd week, we call it our 52 points of light. So that's what's being referenced here, is that weekly spending report that is produced. And it's been in place for a long time.
The amount of people that were on Medicaid at that time and the people that were on public assistance was way bigger than it is now.
Not for Medicaid, though.
Well, how many people did we have on public assistance at one point during Snelling's?
Well, if you're talking about Reach Up, the high point before it was the old AFDC program, in 90, just before we went to welfare reform, it topped out at a little more than 28,000 beneficiaries. And then it's now, Reach Up is now what, 12,000?
Yes, right.
Something like that, just off the top of my head. But for Medicaid, the 52 points of light, that would be before we went into Dr. Dinosaur and did our
before the
behalf.
expansion,
Yeah.
but the basic population was higher than.
Oh yeah, because the categorical.
Yeah, the categorical.
Population.
Yeah.
Okay. Well, that's really old history.
The 50
Any other?
points is very useful to us. That's for sure. I mean, we pay close attention to it's the diva spend on Medicaid. And we
Yeah,
pay
well,
close
when
attention
Medicaid
to-
first started, it really was for people who are receiving the old AFDC, families with dependent children, or aged, blind, and disabled assistance, or you were in a nursing home. That was it.
Yep.
So there's, for those of us who have been around a long time. And there are some of us on this committee that have. Senator Sears, he was back when we still had Virgins.
Oh, yes.
Which every Vermont child, including myself, got threatened with being sent to Virgins if we didn't straighten out.
But it really turned out it was really just a campus. And
I know.
like a prep school, the way, what was Harrison Greenleaf?
Yeah. Uh-huh.
Does that take you back?
It does, and they had their own band. They had really, it was like a whole self-contained community. When you,
Except
they had
we
the
really
chapel.
didn't know, we really didn't know what went on behind those doors.
Yeah, I suppose it's a bit like the, what we're hearing about the orphanage, and for example. So
I don't know if it was that bad, but I think there was a lot of kids who were certainly disciplined in ways that we would not be allowed to discipline them today, which is I'm not arguing it's a good thing. Just saying.
Yeah. Mm-hmm.
Back then, I think the kids were, the discipline was pretty severe.
I would agree. Well, I guess we've have enough, I won't call it ancient history, just past history. And unless there are further questions of Corey or Lisa, or they have anything more they want to add, we will let them get back to their regular duties. Thank you very much, Corey and Lisa. Appreciate it.
Good to see everyone. Thank you.
Thank you.
So Chrissy, we have finished our testimony. Is that right for today?
You have finished testimony for today.
Okay, so what I'm going to do is adjourn the committee for today, and then we will take up our testimony tomorrow. Who do we have for tomorrow?
Tomorrow, we are hearing from the higher education, Vermont State Colleges, as well as Michael Sherling.
Okay.
Madam Chair,
Yes.
I have a question about procedure. I've heard you say a number of times that appropriations usually doesn't take testimony from witnesses. We take it from the agencies and the people who are implementing. So I've started to be contacted by groups related to higher education, sort of around the orbit of the Vermont State College problem. Should I tell them that in general, we don't take testimony from witness groups in
where we provide that testimony, if it's around funding requests?
Well, it's sort of around bridge funding, yes, but also restructuring generally.
That would fall into, we would rely on the education committee to take that kind of testimony, because I believe that the study committee does recommend that there be that what we have in statute right now relative to the state college system is very minimal, and that in terms of the goals and having a clearer statutory articulation of what we want from that system, would that testimony and that language that is viewed as recommended as needed, we would rely on the education committee to do that work.
Okay.
Obviously, anything to do with the funding, the bridge funding, we would hear the testimony on that from the chancellor's office, simply because that's where the appropriation would be managed, but
Right.
anything other than that would be, I would
Education.
recommend Education Committee.
Okay, good enough.
It-
Yes,
And
Rich?
we do offer the opportunity when we do the when in the past when we've done our regional meetings that individuals can come and get 3 minutes to testify.
That we do have our public hearing and it's about money, but if they're really talking about consolidation of functionings or, you know, that we would create this single entity and move away from that sort of separate, all of that, that organizational design I would rely on our Education Committee to.
Yeah, this is the labor group. They may have contacted you too. They have their own plan for unification of the campuses. So it didn't seem like something that we would want to get into, but I'll send them to Senator Campion's committee, and then on Richie's suggestion, I'll tell them that we do, once we get to work on the budget, we do have regional meetings and that they can testify.
We
at
do,
that.
actually, we have them scheduled for February 8th, public hearings.
Okay,
And that's where we provide the opportunity for individuals to come forward and testify. And they can submit written testimony as well. So, but it would generally be around, you know, the level of funding necessary for the bridge. There's money within the capital bill. It would be with that fiscal focus that we do have every year. We have joint hearings with the House to hear spending requests, or oftentimes people will come to support a particular, if the governor proposed it and they like it or they don't like it, it will be either it's not enough, we want more, or whatever. So
and I think in one way it's going to be an ongoing misunderstanding that people have. I think some people think that the state is going to design a plan and then we're going to put it in a statute and the state colleges are going to have to reorganize according to that. But it's really the trustees that are going to work on the recommendations that come out of the select committee, with agreement on funding from the legislature.
well, you're part of that study committee, so you probably understand it better than any of us in terms of how that process would move forward. I did think that there was at least a desire to put something to flesh out in the statute, and I thought that might be something that would be done this year, but I'm not sure what the time frame was for that, Phil.
I think Brian Campion is down to complete that this year. That's really only a general statement of.
No, I understand.
But okay, so I think I get it now. I'll give them those two other alternatives.
Okay, all right, thank you, Alice, and then Chrissy's got her hand up.
What time is the public hearing on the 8th?
There are two public hearings on the 8th. One is midday, and we can send that information out. I think one is like at 6 at night.
That's correct. I can send you all the links. I mean, all the information. So you have it.
Thank
I'll
you.
put it on your calendars and an invite as well.
That's
Senator
awesome.
Kinzer, would you like me to go offline?
I'm sorry.
Activity for today? Offline?
Just so you know. Oh,
Yes.
I'm sorry.
I'm sorry, would you like to go off live? Are you done with it, or are we still?
Question.
The question, if it's just around the logistics, yes, we're done the test